Okay, welcome everyone to day 2 of the Onero Institute Young Leaders Summit. My name is Alad Raymond and I'm the founder and executive director of the Onero Institute. We had an excellent start to the summit yesterday. We heard from 2 wonderful presenters. Yesterday we heard from Josh Pope, who talked to us a little bit about Taiwan and the shifting security posture there in the recent year. We also spoke to Ivana Diargents, who gave us an overview of European strategic autonomy and the future of European security. Today, we're going to begin with an extremely important topic. We're going to hear about global implications with Shelly Lim for climate change and its effects on health equity. Before we do so, let's get a quick review of all the events that we have going on today. Today is the biggest day of the summit. We have so many things happening. It's really going to be exciting, and I hope that you're all able to join us for as much of it as possible. So as I mentioned, we're going to begin with Shelly Lim and her presentation on climate change, extreme heat, and health equity. She's joined by 2 wonderful guests who I will let her introduce in a moment. At 12:05, we're going to introduce our Global Political Movements panel. This is a panel of a few speakers who will be coming after Shelly, who will be speaking about issues with regard to global movements in various countries around the world. Next, we're going to have Yash Bajaj present on vaccine nationalism and multilateralism. He just recently published his piece with Onero. He'll be joined by Jared Tucker as a discussant. Following that, around 12:50, we're going to have a lunch break. It's important to do that. Make sure to go get hydrated, get some food. And then at 1:35, we have a special event for Onero members. Onero members can find this link in their email. It's the only part of the event that's not on the same link. And that is the Onero community activity. And this is just an opportunity to get to know each other a little bit better, hang out, play some games, as a little bit of a break in between all these panels. At 2:15, we come back to our regular programming when we have our Young Professionals in International Affairs panel, featuring 3 people who have just recently graduated college and are now working in various sectors of the field after an international affairs education. We'll get into that a little bit later. That will be moderated by Marcos Nordenstahl. After another short break, we'll open with Maria Alexandra de Agostino and her presentation on understanding FGM in Sudan and around the world. At 3:55, we will introduce the Rising Themes in International Affairs panel. This panel will be the second panel of the day, and it will focus on, as we say, rising topics in the field, topics that are kind of new, that are a little perhaps untraditional when it comes to international affairs, and we're gonna have some exciting talks there. We're gonna start with Rishi Narahari, who will be discussing his piece that he published on the tech boom in Hyderabad in India. Next, we'll have Everett Pastel talking about genetic data protections in the United States and European Union. And finally, we'll round out with my co-founder and co-executive director, Andrew Ma, who will be presenting on deterring foreign disinformation campaigns at 5:20. You can see all of this and more on the Onero Institute Summit webpage, by which you can also access the Zoom link later on today. But without further ado, I would like to turn over towards Shelly's presentation. And before I give her the ability to screen share and get us started today, I'm going to just give her a quick little introduction. Shelly Lim is a public health graduate student at SUNY Downstate Health Sciences University. She focuses on epidemiology and health policy with an interest in global health. Shelly is from New York City and enjoys working on population health projects to improve health disparities in communities. Her piece on climate change, extreme heat, and health equity will soon be published on the Onero website. Shelly's presentation is part of our Global Prospects Development Institutions panel, which we will discuss in more detail tomorrow when the remaining students in this panel present. And I will be also introducing her discussants. She has 2 wonderful discussants with us today. We have Michelle Pawalczak and Maria Rojas, both from Climate Reality, both leaders in Climate Reality and trained by former Vice President Al Gore. They've had experiences working for programs to help homeless people and to help lower income people receive benefits. Without further ado, I'm going to go ahead and turn over to Shelly. Shelly?
Thank you, Alad. I'm gonna share my screen now. Can you all see?
Yes, that's good.
Okay. So thank you so much for the introduction, Alad. We're thrilled to be here today. Now, if you can all press on a response emoji, I'd like to ask all of you, how many of you have felt the heat waves across the country earlier this summer? Awesome. Well, a lot of us have experienced them earlier in June or July or experiencing them now. And they're becoming more intense and frequent every summer because of climate change. And it's making it harder for a lot of people in the United States and around the world to deal with this extreme heat. So how does climate change affect health? Global warming and the resulting large-scale shifts in weather patterns can lead to environmental degradation, which can lead to forced migrations and several conflicts. They can also impact water and food supplies, leading to malnutrition and diarrheal disease. There can be changes in ecology, making us more vulnerable to diseases like malaria and Lyme disease, and air pollution from extreme heat. This one we've been seeing through air quality warnings can worsen asthma or cardiovascular disease. So what about extreme heat exposure? That can directly lead to heat illness through dehydration, heat cramps, or heat strokes. And it can worsen pre-existing conditions like respiratory disease and even require hospitalization or accelerate death. There's a lot of other indirect impacts like response times for health services and effects from your surrounding environments as well. Extreme heat has been known to exacerbate mental health problems, even for the general population, and it can increase aggression and violence. So today we want to focus on some populations that are more vulnerable from extreme heat. Now, increasing average annual temperatures has led to winter snow melting earlier, and this leads to warmer, drier forests, which are better conditions to start and spread wildfires. We've been seeing more frequent and intense wildfires, especially in Oregon and California last year and this year. So even now there's like 91 wildfires burning across the United States, with Oregon's bootleg fire growing to over 400 acres. That's not expected to be fully contained until October. And since many of you are familiar with the Washington, D.C. area, this fire is about 9 times the size of Washington, D.C. To give you a comparison. If you look on the graph towards the right, you see that the number of acres burned annually has drastically increased since 2010, and over 3 million acres has been burned since September of 2020 due to California wildfires. That's about 3 times the size of Rhode Island. On the right, you can see that the percentage of households at higher extreme risk from wildfire in Western states. And like in Montana, over 25% of homes are at high risk. In California, 15% of homes are at high risk. This is a large chunk of homes which are going to need a lot of money to avoid wildfire destruction, to be wildfire resilient, or to rebuild. And this graph here shows the expected increase in average annual person days of exposure to extreme heat for US regions when comparing the period between 1971 and 2000 to the period between 2041 and 2070. So as you can see, the West, South, Central region, including states like Texas and Louisiana, are expected to have the most average annual person days exposed to heat. And this is followed by the South Atlantic. A lot of these states, like Texas, have high homeless populations, especially those who remain unsheltered. So I'm going to ask Maria, what's the connection that you're seeing between extreme heat and homelessness?
Okay, good morning, everyone. Thank you, Shelly. Well, Shelly, it's connected in every sense because I don't know if you are aware of that, but over 580,000 people in the United States are homeless. So if we think about ourselves, when we are facing extreme heat and we can get into our cars, into our house, our jobs to be able to cool down and everything, imagine people on the streets. So it affects them in all sense. For them, it's even worse because they are at high risk. And not just talking about the hot days, but also talking about hot nights. Now they can't even be cool during the night because it's extremely hot. And talking about the ones that are already homeless, this is a problem. But what about the ones that are probably becoming homeless because of the same situation? So if the global warming continues, what is going to happen is that more wildfires, more flooding, so then more homes are going to be more families will have to leave their homes. So we're going to have higher levels of homelessness, which is going to be a crisis everywhere, not just in the United States, but everywhere. But we're talking about United States, which is already a big crisis. If we talk about just, let's say, New York, you can see a lot of homeless people on the streets. And can you imagine what's going to happen in the coming years after COVID? Because right now, some families, some people are already facing problems to pay their gas, their electricity, and now they need to use more AC because it's so hot during the day that the only way for you to cool down, it's go into your house, go into places that you can be a little bit cool. If we talk about homeless people, they don't have this place to go. They are out there on the streets, so they face risk of heat stress, heat strokes, pollution. Definitely, the quality of air is really bad for everyone. But those people who are out there, they are facing this every single day and every single minute during the day. So this is a really big problem, and the connection is all with them. But we have to think about not just them, but what about us? We are not exempt for having a natural disaster. So if a natural disaster is in our areas, it's not going to be just one house. It's going to be an entire community that is going to be homeless. And some regions in the country are well prepared for this, but I will say that most of them, they are not. So warming centers or cooling centers are not everywhere. So that could be one of us one day. So we can think about just the future, but we also have to think that now we are living in this present where global warming is increasing extremely. So if we need to use more AC in our houses, it means we're going to be using more burning fossils, which means more pollution, which means more natural disasters. So this is one thing that we have to think about, especially with those more vulnerable communities like the homeless population.
Absolutely. Thank you so much, Maria. And I agree with you. Having to remain unsheltered is indeed like a result and cause of health problems among homeless people. And on a side note, I'd like to add that many agricultural and outdoor workers suffer from heat illness.
Of course.
Due to the prolonged extreme heat exposure.
Exactly. Yes. And I think it's very important that we think about when you see a homeless person out there, think about them and just see them. They are not invisible. They are right there and they are part of our society. So we have to think a lot about them and start having a conversation about how we can protect them from this climate change. Thank you.
We need to have more of these conversations. So briefly, I want to go over the social determinants of health, which are conditions in the environment where people are born or raised, where they learn and work that influence the quality of life and health outcomes and risks. So the 5 domains are generally economic stability, education, healthcare access and quality, neighborhood and built environment, and social and community contacts. So over the years with climate change, we're going to see existing health disparities due to factors like poverty and racial discrimination worsen. We're already seeing that people in poorer neighborhoods are generally more likely to be exposed to climate change health threats. So a study has shown that low-income neighborhoods often have less tree cover and hotter average temperatures than higher income neighborhoods due to years and years of exclusionary zoning, which has forced poor people, unfortunately, into dense and poor infrastructure areas. And this is making them more vulnerable to heat illness. So I'm wondering, I want to ask Michelle, can you tell us more about an example of disparities in healthcare access that you've seen in your experiences?
Sure. Hello, everyone. Thank you for the opportunity to be here, telling a little bit about the situation that is going on. So before I answer your question, Shelly, I just want to put in perspective why we're talking about medical access when we're discussing about climate change. So let me just tell you that in the last decade, about 150,000 people are dying annually because of consequences of climate change. If we don't do something about it, between 2030 and 2050, 2050, this number is going to grow to 250,000 people that are going to be dying because of issues with climate. So now we're going to talk, you're asking me about examples on the disparity. Well, overall in the country, as many of you know, the disparity has been very clear in between the rural areas and the urban areas. We're talking about states that don't really have access to the main simple family care that we will consider just as a part of our normal routines when we live in the urban areas. When we live, I'm not sure where the audience is located, but we all know that definitely in the East Coast, we're going to have a better access than the access that is available in the central areas. On top of that, we're seeing an increase in closures of hospitals in rural areas. We're talking about in the last decade, we have about 113 hospitals closing, especially in the central rural poorest areas of the country. This is a huge impact because these people are just not having opportunities to go into to the doctors that they usually will do. We are talking here about the telehealth as a potential solution. Now, when we talk about telehealth, many of us didn't really think too much about it until last year when everybody was enclosed, we were behind doors, and there was an opportunity to access to the doctors. Well, this is something that has been available for a while, but because of certain regulations in the states, it hasn't really been put together. It hasn't had the thought that deserved it for many years. But it's an increased solution. It's a solution that is being used more and more often. But also, we need to consider that the rural areas won't have the same access to what is needed to have telehealth. So when we think about telehealth and we're in New York, we think we have the Wi-Fi, we have the apps, we have all of these things that are needed to make it happen. Well, is that the same case in Kansas? Is that the same case in Missouri, in Mississippi? They might not have that. And again, we're talking about the disparity. They're not going to have the access. And here I am answering your question, Shelly. When we don't have the access to these little things that could make the access better for the populations in rural areas, we have a problem. So before we talk about the alternatives, we need to see that all the things that are needed to be put in place, the platforms and the connections, the connectivity to have that access is put in place. With the pandemic, it was a big wake up because we realized that many areas were not ready for this. And when we're talking about a pandemic and we're talking climate change and everything that was happening, we see states that are supposedly states financially stable as Texas, is struggling because they had a situation like the one that they had in February when they had this winter wave that were not ready. They were not ready, and showed the disparity between a state that we see as a wealthy state and the population in the more rural areas that had to deal with the impact. Now, I would like you to go to the next slide, please, Shelly.
Yes, of course.
Because we're talking, here she put, Shelly is showing you the status of the state Medicaid expansion in 2021. What are we talking about this? There's so many implications in how we can talk about this, the access to medical, and unfortunately it doesn't really have to do with how many psychiatrists, family care, emergency care access is available in the states, but it also has a political implication. And we see states in the South really not expanded yet. But at the same time, when you guys, if you guys want to do some research and look into this, you'll see that these are the states that are more impacted right now by climate change. So we talk about which states are the most impacted by climate change. You'll be surprised that are in their area. I can tell you that I have here a list where Florida is the top one impacted. You guys hear all the time about the hurricanes, the seasons, and everything that is happening because of that. Arkansas, Louisiana, South Carolina, Mississippi, Kentucky, those are the states, those are the top 5 to 6 of the states more affected by climate change. And when we're talking about the relation between climate change and access to medical, that's a problem that needs to be solved. Now, how this is going to happen? I guess that they're going to need to have some conversations. If we're not talking about Medicaid expansions, if we're not talking about some access from public, we need to see how this is going to be done so we can assist and the disparity becomes less and less and less. The inequity becomes smaller between the access that we have in states like New York, states like New Jersey, and the access that someone in Tennessee, in Mississippi can have to medical.
Thank you so much, Michelle. You brought up an interesting topic about Medicaid because as we saw from the coronavirus pandemic, we saw how a lot of people lost their jobs and therefore also lost their health insurance because of this employer-linked health insurance. And we're going to see in the future, when more people suffer from natural disasters, we're going to have to change the way we view health insurance and healthcare.
Yes, I can tell Shelly that unfortunately we don't know what is the status, how prepared the states are for this, and what federal funds have been available to support the needs of the states. So I can talk about the New Jersey case. In New Jersey, we had about 200,000 more people added to the Medicaid program because of the pandemic. So this is just one of the triggers, but there's so many things that are triggering. Definitely climate change is something that is going to trigger the need for access to medical coverage across the country. So it would be interesting to see what other states are doing and how they're preparing for in case that this is needed sooner than later, and it's going to happen sooner. It's going to be needed sooner than later.
Absolutely, I agree with you. And last year, I think what's worse is that many of our public health and healthcare systems across the US, like on all levels of government, hadn't been ready for a disaster like the pandemic. Even though we've learned from the SARS and Ebola epidemics, there is hope, however, we have to maintain hope. There's work being done to reduce carbon emissions and improve carbon pricing. The Biden administration's Infrastructure Investment and Jobs Act includes funding for climate change protections. And what's interesting is that I think it emphasizes jobs for workers. This can help boost the economy in rural areas where it's difficult to find work. And it also recognizes the need for our care economy. We've seen how essential our healthcare workers are. This funding is going to create jobs and raise wages for essential home care workers. So that's going to help a lot of our elderly and disabled people. And we can also do our part by raising awareness of climate change, encouraging more sustainable policies in our fields of work and our communities, and also improving social inequities. We have the power to take action, and by attending this summit, you're already youth leaders and leaders. So finally, we want to encourage you all to sign up for the Climate Reality Leadership Corps. It's a fantastic way to learn about climate change, connect with the community, and take action against climate change. So thank you very much to Michelle and Maria for sharing their experiences. And thank you to Alad and Andrew and the Onero team. And thank you everyone for letting us share this time with you.
Thank you, Shelly. That was really wonderful. And I think that you've really touched on a lot of critical issues here that as Shelly had mentioned, I would strongly encourage you all to continue to push and learn more about. Shelly, do you have any closing words for us as we begin with you and your discussants have some closing words for us as we kind of stick with this topic a little bit longer?
Like I said, thank you all for sharing, for letting us share our experiences with you. And we encourage you to join the Climate Leadership Corps.
Excellent, excellent. And I think that, the experience that you've had this summer working with the team and taking the training has, certainly, I mean, if we're just working with you as an editor and seeing your progress on this topic, it's been really phenomenal from this side of things. So thank you so much, Shelly. And I wanted to actually ask you if you wouldn't mind speaking a little bit more about your experience in the training, because I think that is something really valuable to share with this community that, we're trying to mobilize and move on such an important, critical topic, especially since you all have so much experience here. I would love to hear if you could share just a few words with us.
Sure, I'd like to share a little bit, and then I can let Maria and Michelle talk more about their own experiences. We've had, I think, 4 sessions that are on weekends, and these sessions include a broadcast by Al Gore, Vice President Al Gore, and he led us through all aspects of climate change, from public health to infrastructure to energy and the economy. And I think that by being able to learn more about these different aspects, we get to understand how climate change fully impacts not only the United States, but also countries around the world, especially countries in the global South. And afterward, the broadcast, we get to speak with our group. That's how I met Maria and Michelle. Our group was led by Jeremy Kagan, I believe, and we got to share more about how we felt about learning from these broadcasts, how we felt about taking action, taking leadership, and I'll pass it over to Maria and Michelle.
So,
yes.
Go ahead.
So I agree with Shelly. Yes, it's a very good opportunity for us to be part of the solution, right? Many people think that you need money, you need a bunch of infrastructure, you need many different things to be able to make change. No, we can be the change just being one of us trying to do it. So as she was saying, you have the opportunity to connect with people like Shelly, like Michelle, and then it's when a group of people get together with the purpose of changing something for good, is gonna happen. It's gonna impact the lives of other people or your own life. So joining groups where you're going to be supported, joining groups where you're gonna learn about what you can do to better your life and others' lives, that's the most important, because at the end of the day, we are humanity. The planet, global change is all of us. It's not just one part out there, which I think that's the way we see it sometimes, like, oh, it's climate change, but it's not happening here. So it's right there. It's in California and I'm right now in New Jersey or in New York. Now, climate change is happening everywhere. So I think this is a really good opportunity for everybody to learn, to have more connections, and to do things that are gonna make you feel happy, passionate, and of course, giving back a little bit to this beautiful planet that we have.
So I would like to add to what I said. We're used to know our stories, but we're not used to we don't know everybody else's story. And these kind of sessions, and definitely this training, brought us to an opportunity to hear other people's stories. And not only the story, but also the background that we have and how we can help based on what we do in life, based on our stories, based on our backgrounds, based on what we have lived and what we want to happen in our communities. We are individuals in societies, and these societies need to work together into making the changes. We usually say, well, I can do it by myself. I can do it by myself to a certain point, but then I need the connections to make things happen. So this is important. This is why it's important to have this kind of venues, to have these conversations. One thing also that we need to realize is that the future is now. We tend to say we want a better future for our kids. Well, guess what? Our kids are here already, and this is happening now. We cannot wait until somebody else, until the next generation, have to solve the problem that is happening right now. We're seeing it. We need to act now. This is no time for waiting. We see kids already actively working in their communities and doing stuff. So now us as young adults, and all the generations need to get to put together their thoughts, their ideas, and start working into making this planet better, because this is the only land we have. As Carl Sagan said, many
vitamin B.
years ago, the little blue dot that you can see from the space when they went to space and they saw Earth, and it was this little blue dot. That is where all the history of humanity has happened. Everything that we have heard about humanity is what is happening. And if we don't act, that is where everything is gonna end.
Thank you so much for sharing that, Michelle. And you know, one point that you mentioned really stuck with me there when you're talking about how you know, we need all the generations to work on this, and the young people are here today. Because that, you know, that's a lot of what we talk about at Onero here, is the whole idea is that, you know, yes, young people are tomorrow, but they're also today. They're also today. They can be involved in this right now. That's why we have people like Shelly who are coming out, presenting, and working on these issues today. And so I think that it's really important. It's really wonderful to see climate be more incorporated into this dialogue. I think if you, about 5 years ago, kind of went to any international affairs or even political science school or anything, kind of climate change would be kind of classified as the non-traditional topic to talk about. If this summit was 10 years ago, we may even put it in that rising topic. No, it's not a rising topic anymore. It is the topic. It's the topic. And
it's
so,
a hot topic.
Exactly.
It's a hot topic. Yes.
Literally and figuratively, yes. So I think that I'm so happy that we were able to have you talk about this here in the summit. And I wanted to ask just one more question to wrap this up, because Onero, we cover so many topics, and it's really such an honor to have the topics that everyone is passionate about, so many different things. But we look at things in I want to kind of open it up to an international perspective. This is such a wonderful review of the case in the United States, now that that's the area of focus and expertise for some of you. But I was wondering if you could take this, what we talked about, and just apply it to the international stage, and how do you think that changes things, and how do you think that as a global community we need to come together to address these kinds of issues?
Well, I think that the countries need to compromise into the global solution. As every country has the responsibility to do their due diligence for what is happening, particularly in that area. Not only that country, but in that area. I'm from Colombia, I'm from South America. We have a huge problem where if we don't act right now, in 80 years, half of my country is gonna be, there's not gonna have places where people can live safely because of the heat. And just also Colombia, we have had previous discussions about this. So each area needs to work into their particulars, but we also have to bring this into the community, global community venues to discuss the problems, because we need to ask for help. We cannot do anything in South America if we're proposing to have initiatives to stop what is happening in the Amazon if we don't have the countries, the industrialized countries, polluting and doing all the stuff that they're doing to damage the environment. And the efforts are just gonna go nowhere. So efforts are gonna only go forward if we all work together.
First, I appreciate the intersectionality between climate change and many other movements, like the labor movement, LGBTQ, gender rights, and many more. And second, I think that the good thing about countries coming together to fight against climate change is that we can take the time to recognize each country's strengths and how they can each contribute to climate change. So I remember from Al Gore's lectures that like a lot of Latin American countries are working to build windmills and also use hydroelectric power to provide a lot of the world's energy and power. So I feel that if we try to improve on these resources and on these strengths, then we can unite and cooperate together.
Yes, I agree with Michelle and Shelly. And as Michelle said, I'm Colombian, and the crisis is everything because it involves not just only extreme weather conditions. It's a lot of things, violence due to climate change. Then people has to migrate, and you can see that actually impacts the United States because people from Latin America are migrating in tons. It's not just one person; it's like hundreds of people migrating, and it's not just because of the climate change, but that is the main point that makes people get into, violence, because it's corruption, because there are many things that are related to this. So it's a global problem, because places like Syria, which I thought it was just because of the political and economic reasons people were migrating. No, they're migrating because of extreme heat, and this is creating a crisis, a global crisis. So this is a global problem, and as I said before, it's a human problem. It's our problem. We are the ones creating this. So we have to be the solution, and it has to be now. We can't say, oh no, you know what, I'm gonna try to do something next year or in 2 years. No, because now we need those solutions. And the bigger countries, the economically potential countries, are the ones who have to compromise, because without their compromise, other countries are not gonna be able to make it. And countries, third world countries, are going to be the ones that are suffering already and will be suffering even more. So we have to definitely do something about it.
Elad, I want to add something. I can guarantee you, I was counting how many people we have participating here. We have 21 people. I can tell you, I can guarantee you that at least we have people from 7 countries joining this conversation. So we have 7 potential countries, people from these different areas in the world listening to this, compromise to what are these ladies saying? What can I do that this impacts that is touching me right now because I have lived it in my country? So these are the opportunities where we want to hear, what are you dealing with in your areas of origin? Where you come from? And how can we support this? United States have the beauty of being this melting pot where we'll come here and we're talking and having this discussion. Nowhere else in the world, we're gonna have people from so many places in the world listening to a conversation like this. And the youth right now, where you're listening, you guys go to your countries, you guys have your families, your relatives, your friends. Start working into what is happening there. And if there is anything that can be done, that can be listening from what is being done in different parts of the country, let's have the conversations so we can find solutions together.
So much, Michelle. And I think that really, it really sticks, because there's so many things that one can do. It can feel overwhelming. It can feel very hard to know where to start. But I mean, things like this are just a great way to do so. And like you said, everyone has their own community, and this is an issue that affects everyone. There's no one that this doesn't affect, unless you live on Mars or something. There's no one this does not affect.
There's only one blue dot.
That's true. There's only one. There's only one blue dot. I wanted to ask another question, and I also want to invite anyone in the audience, if you'd like to ask anything to our panelists, feel free to just shoot a message through the chat. But I want to ask one more, and that is that I mentioned now that climate has taken a really critical role in international affairs discourse, and this is we love to see this. We want to see that this topic is talked more and more about, because that will translate hopefully into action on the subject. But another trend in the discourse is viewing climate as a security issue for the first time. It didn't used to be viewed that way. It used to be viewed kind of as the general. The debate was more whether it's real or not in the beginning, which was it's a very different time now. But now it's all about whether how does this impact the security, both human security, but also national security in a global world where fortunately or unfortunately a lot of states think that way. So what thoughts do you have with regard to climate becoming a security issue, and how do you think that's going to affect the way that countries and action is taken on this topic moving forward?
Okay. Well, I'm interested in learning about the military. So I've been learning that because of climate change, and definitely there's been extreme and frequent natural disasters across the country and around the world. The military has made it their focus to prepare for climate change and to prepare their forces. So I think that because of the extreme events that we're going to be seeing and how they're going to impact people, we're going to see countries needing to prepare their healthcare systems, their military, and their humanitarian aid to help each other. We're already seeing that through during the COVID-19 pandemic, countries are helping each other. I feel that through these disasters, we're going to have to come together again, not only to fight against climate change, but also to help everybody who are in need of aid.
Thank you, Shelly. Yeah, I mean, I think you put it really, really nicely. I couldn't have put it better myself. I think that, you know, we're going to continue to be talking about this issue for a very long time. I can anticipate that even at Onero, many of our pieces in the next, you know, year, 2 years will be focused on this topic. And I'm always encouraging our researchers to incorporate it somehow into their papers, because there's, like you said, the intersectionality is the big thing. And I think that is something that, you know, students are learning more and more how to apply that into their work and how to address that. And that's going to be so huge. We cannot look at climate in a vacuum. So your topic on climate and health equity is just the first step. And we really appreciate you coming out and doing that for us, because I think that, you know, you have, you know, could have really changed the perspective of someone who now sees these issues as interacting with each other in a new light. So
I agree with you a lot.
Thank you so much.
I just wanted to add that, like with climate change, we're going to see a lack of resources, like droughts and civil conflicts. We might be seeing that, but I think that it's more important now than ever to have countries come together and have people come together.
Absolutely. Well, thank you all so much. You were really phenomenal. We are so happy to have you, and we can't wait for you to come back next time and talk to us again. And we can't wait for Shelly's piece to be published on the Onero website. Keep an eye out for that in the coming weeks. But without further ado, we're going to be moving on to our next topic. So thank you so much to Shelly, Maria, and Michelle.